Welcome to the Mestex Emergency Action Plan, EAP, Medical Emergency Plan Training. This is a guide for managing medical emergencies at the workplace. The purpose of the medical emergency plan, we will discuss during this training the opportunity of the purpose of the medical emergency plan, the types of emergencies covered, and the responsibilities and protocols. So the purpose of the medical emergency plan is to provide employees with essential guidelines during emergencies. Also to comply with OSHA's Emergency Action Plan standard. For types of emergencies covered, we have medical emergencies that consist of minor, serious, and severe incidents, also identifying the level of injury and the appropriate actions to take. Next, we will discuss the responsibilities and protocols. First, the safety manager and supervisors play a crucial role in ensuring that safety and the well-being of employees during emergencies. Also, in collaboration with our local resources, this is essential for the success of our emergency response. For minor injuries require only first aid. A minor injury can be a superficial scratches, cuts, scrapes, or burns. Actions to take: you must use the closest first aid cabinet, report the injury to the supervisor, being the employee's responsibility, and then supervisor must fill out a near miss incident report. It is the supervisor's role to complete the report and follow up on the employee's condition. For serious injuries, not life-threatening, these injuries do require medical attention. An example can be a deep cut or fracture. Actions to take: we must transport the employee to Concentra or Parkland's emergency room. The supervisor or a designated first aid responder will accompany the employee. Next, we must seek emergency treatment if bleeding cannot be controlled and if there is a visible object or a deep wound, or if a tissue or bone is visible. These are examples of serious injuries but non-life threatening. Next, we will discuss severe injuries that are life-threatening. Severe injuries require immediate emergency response. Examples can be an employee fall, electrocution, exposure to harmful substance. Actions to take: we must immediately call 911. Next, we will provide details to the emergency that will include the nature, the location, your name, and phone number. We must not move the victim unless absolutely necessary, and we must call trained personnel to provide further assistance. Here we have some examples, visual examples of threatening injury types. These are common life-threatening injuries. Again, a fall, struck by incident, electrocution, machinery incident, and also motor vehicle accidents. These are all examples of common life-threatening injuries. Now let's talk about our first aid and our CPR response. Actions to take before help arrives. 1, we must stop the bleeding with a firm pressure on the wound. We must avoid contact with bloody fluids, and we must also use the bloodborne pathogen kit. For choking victims, we will perform the Heimlich maneuver. If hazardous materials are involved, the first aid and CPA response will consult the safety data sheet and also wear the appropriate personnel protective equipment. All right, we're going to move forward and we now will discuss the overview of responsibilities. So we have key roles in emergency responses that belong to our safety manager, our supervisors, and our local public resources, our EMS, emergency medical services, and fire department. So beginning with our responsibilities of the safety manager, the key responsibilities include maintaining the plan by providing regular updates and maintenance to our emergency action plan. Also reviewing the plan annually. So there is an annual review, and this will ensure that the plan's adequacy by reviewing it annually. It is also the responsibility of the safety manager to provide employee support by addressing employee questions and concerns about the plan and granting immediate accessibility, making sure that the plan is readily available for the employees to review. All right, we'll move on to the responsibility of our supervisors. Our key responsibilities for the supervisor consist of addressing the situation, and this will include determining if the emergency exists that requires activation of the emergency procedure. Our also supervising emergency efforts by overseeing the evacuation of personnel and other emergency actions in the area. The supervisor will also coordinate with outside services, being the direct point of contact to our external emergency services like medical aid and local fire department. Now we have our coordination with local resources. This is our collaboration with our public resources. This will include the safety manager coordinating with our local fire department and our emergency medical personnel while ensuring that they are prepared to respond accordingly to our emergency action plans guideline. It's very important to provide effective communication. Communication and reporting will consist of one, the importance of clear communication between the safety manager, supervisor, and the emergency services. Also, reporting the procedures to ensure that all incidents are properly documented and handled efficiently. All right, in conclusion, we have our summary. Our summary will follow the guidelines based on the severity of the injury while always reporting injuries and filling out the required forms and the responsibility to keep safety and compliance at the forefront. Thank you.